The health service has started winter under unprecedented strain, and today came a warning that our hospitals are already so full, patient safety is being put at risk. In winter, the average hospital trust in England has 640 beds available. But our analysis of the data reveals on the worst day so far, Wednesday, December the 7th, there were 28 hospital trusts operating with fewer than 6 free beds, including 9 trusts which had no free beds at all that day. Across that whole week, 94.6% of all hospital beds in England were occupied. And full wards means staff stretched to the limit, as Poppy Hasted experienced this time last year. She has multiple sclerosis and was admitted with pressure sores.
The nurses and doctors are just under so much pressure, so much stress with people coming in. They couldn't stop. They were running around all over the place. Bless them. It was like they hardly even had a chance to have a cup of tea or get their prescribed break.
Hospitals try their best to cope by opening extra beds. A new analysis by the Nuffield Trust has found last winter the number of beds brought into service each day was the equivalent of 5 whole hospitals opening. But when those beds also get filled, the risks escalate.
Hospitals can start to experience problems with infection control, so there's not enough time between patients to clean beds properly. It can be difficult to admit patients from A&E, for example, so people can end up on trolleys waiting in corridors. It's poor for staff, stressful for them to manage the situation, and in the end it's a poor patient experience.
Trusts have now been told to stop most scheduled operations for the next 4 weeks to cut their bed occupancy rates to 85%. The NHS says patients can also help take the pressure off by avoiding A&E if at all possible. Catherine Jones, 5 News.